Okay, they've gotten in, they've adhered, they've established themselves, they've caused infections, diseases. Now they have to have a portal of exit, a way to get out. This can be done by mucus or sputum or saliva or nasal drainage using the respiratory and salivary portals. It can be from shed skin cells, fecal exit, usually by diarrhea, through the urogenital tract, by semen or vaginal discharge, and by removal of the blood or bleeding. Those are all portals of exit. Now, when the host recovers, or it looks like they've recovered, it doesn't necessarily mean there's no microbe at all there anymore. It can be latent. Like after you have initial symptoms in certain chronic diseases, it can become dormant or inactive. And the person may not shed it during the latent stage. Herpes is this way, so is hepatitis B and AIDS. A chronic carrier is a person with a latent infection who sheds that infectious agent. A sequelae is long-term or permanent damage to tissues or organs. Epidemiology is the study of the frequency and distribution of disease in defined human populations. And it involves a lot of disciplines, and it considers many diseases, not just the infectious ones. It collects information on the causative agent, the pathology, and the way it's transmitted. And they're looking at the chain of infection here. One of the most important concerns is discovering where the pathogen originated and how it is transmitted. A reservoir is the primary habitat of the pathogen. Like it can be a human or an animal carrier, it can be the soil, the water, and plants. The source is the individual or the object from which the infection is usually acquired. Now, living reservoirs would be carriers. They are people who inconspicuously have this pathogen and spread it to others. They show no symptoms if they're asymptomatic carriers. It can be a passive carrier, like a healthcare provider that's contaminated and spreads it to other patients. So when they say they need to wear gloves, that's not just for them, it's also for you. You can see here this person's asymptomatic, but they're still spreading it around. And of course your healthcare providers, waiting or seeing about one patient and then seeing about another patient without washing their hands or something, they can spread these infectious agents around. An incubation carrier spreads it during the incubation period. A convalescent carrier is recuperating and has no symptoms. But a chronic carrier has this infectious agent for a long period. So that leads us to a concept check. If a nurse transfers a pathogen between patients without becoming infected herself, the nurse has acted as the passive carrier.